Hello everyone, I'm Juliette Morrison and I'm going to be talking today about preschool expansion in Washington State. And I'm very excited to be sharing this information for you. This is a result of our integration efforts at the Department of Early Learning to make sure that we are integrating early achievers with all of our programs and initiatives at the State Department. And we wanted to reach out specifically to the child care community to talk about how licensed child care and family homes can fit into our expansion of preschool in Washington State. We're very interested in ensuring that we are integrating our systems. We're sharing the best practices among our different program types as we move forward with preschool expansion. And today I'll be talking about changes to the model, what we're hoping to do with these slots to innovate, and partnerships that you can make in local communities to apply for these slots. Before I get started into the details, I wanted to share some history in Washington State that really does guide where we are today. So on this slide you can see that there was a plan that was submitted in November of 2011 called the Washington Preschool Plan. And in 2011 a group of stakeholders worked in collaboration with the Department of Early Learning to submit this plan to the legislature. And it is a plan to really expand and move toward a universal preschool for Washington's children. In our state, it is time to sort of take that plan off the shelf and think about how we can implement this plan using some of the infrastructure and capacity that has been built over the last few years, using the rich history and work that we have done in ECAP to date, but making sure that we're thinking about how do we move toward a UPK model, starting with our most at-risk children and families. What I want to emphasize at the top of this presentation is that we are not changing anything in our current ECAP slots at this point. Our current ECAP contractors, we're going to ask that they maintain the work that they've been doing historically under the same standards. But what we're using are our expansion slots. So the legislature has granted expansion of ECAP slots every year going forward until 2018, where it will be an entitlement for all children and families who qualify for ECAP. In this next school year, we are going to see an expansion of 1,350 new slots, and we want to use those slots as an opportunity to innovate and move toward the recommendations that were set forth in the Washington Preschool Plan, and that's what I'm really going to focus on today. So in addition to this history of the Washington Preschool Plan, we also have had some things change since 2011. As I mentioned before, we have a legislature that has said they support ECAP and they want to make sure that ECAP expansion continues until all children and families who are qualified in our state are served by our ECAP program. We also have Race to the Top Early Learning Challenge Grant in Washington State, which has helped us fund the initiatives that are really moving on our quality focus, including early achievers and WALK Kids, our state kindergarten entry assessment. With this capacity, we now have a greater infrastructure, a tighter framework to ensure that as we move forward with preschool expansion, we have local community implementation of these quality metrics. And then, of course, there's also the national focus. If you've heard the President talk about universal pre-K, it's really much a focus of the nation, and Washington really does want to be prepared for drawing down any future federal dollars that might come as a result of the national UPK model. What's really interesting is that when you look at the Washington Preschool Plan that was submitted in 2011, there's actually a recommendation to begin implementation in school year 2014. So there's a lot of alignment and things that have been happening in the last couple of years to put us in a position to be able to move toward an innovation model and to offer more than we've been able to offer with our current model. So the title of this next slide is really about more. And as I said, we're really looking to reach more children with these expansion slots, but also to provide a higher level of quality that's consistent across our state. So preschool expansion is giving us the opportunity to do more for our children and families, particularly those at-risk children and families. What we do know that in communities we are not currently serving all of the children who qualify for ECAP. And we know that many of these children are in licensed child care settings. we're interested in ensuring that we move slots to where the children are. So rather than displacing children, we're looking for our contracts to move where those children already are being cared for and are learning. We have three really great assets right now with expansion. One, as I've already mentioned, we have a legislature that has agreed to fund these additional slots, and that's a huge investment, especially during the slower economy. We have early achievers. That's a tool to help us improve and measure quality in a consistent way across the state. And more than just measure quality, we have the infrastructure and capacity to really do some deep quality improvement based on the data that we're getting out of early achievers. And we have our Washington Preschool Plan that really serves as our roadmap for how to build a pre-K program that provides a high-quality, high-dosage service, eventually reaching all children, and within a mixed delivery model where we have contracts in child care settings, at community college labs, in school districts, in our educational service districts, a true mixed delivery across the state. So we're using these ECAP expansion slots as an on-ramp to Washington Preschool, and we're going to use expansion as an opportunity to offer a higher dosage program to at-risk children and families. Our goal in this expansion is to provide a 6-hour-a-day program to as many children as possible, and to ensure that all children accessing pre-K services receive the highest quality. The research is really clear about why we want to do this. We want to get the strongest outcomes for kids in pre-kindergarten programs, and in order to do that, we need to have a higher dosage than our current ECAP model can provide, as well as consistent quality. So that's where we're headed. We want to ensure that pre-K providers participate in early achievers, have access to the supports that come with that, and then eventually transition our pre-K program into a full-day model over time. Now, one of the reasons that we're not changing anything in our current contracts and only using these expansion slots is that this is our opportunity to learn more. We want to invite people from the communities to bring their best ideas that, of course, answer the call of the application that's going to go out. But we're really looking for innovation in the community, and we're really interested in ensuring that our child care providers can also participate in this experience. We also know that in order to do this, that we have to do the work at the Department of Early Learning to integrate more effectively. And that means streamlining a lot of the processes that we have in place. We don't want to burden contractors and providers in the community who are working on quality improvement and quality services to children and families by asking you to duplicate reports and monitoring processes and other things that take time away from your time with children and families in the program. So we're doing our best to move on aligning our program standards, aligning requirements for these programs, and really demonstrating that we're being efficient with both state and federal funds. I just want to comment on why a full-day model. So what, again, we're proposing is our current ECAP model in state pre-kindergarten is to offer at least 2.5 hours per day. And what we want to move toward is to a full-day service, which I say 6 hours, but really there'll be a range between 5.5 and 6.5 hours a day that comes out in the application. And what we know from other exemplar preschool programs in the nation and from the literature is that you need to have a specific amount of dosage during the day to really have that impact on child outcomes. We want to make sure that during the day children have time to practice the skills that they're learning. We want to make sure that they have time for exploration as well as group time and individual time. And in order to do that, we have to expand our current 2.5 model. Now that being said, again, we are going to be testing this out with our contractors who answer the call of the request for application and join this expansion cohort. And we're going to evaluate it to see what do we get out of the expanding those hours. But moving to this full day service really changes the perspective that we've had historically in childcare, and that is that a full day preschool model is really more than just meeting a parent needs to support work. It's also about ensuring that we view preschool as a fundamental child development process that really does impact school readiness. And the dosage, of course, is not everything. There's a lot of quality elements that go along with that. So strong adult-child interactions, ensuring that there are rich learning environments that are organized, ensuring that interactions are not only nurturing, but that there is instructional content to go with that. Strong professional development in practice, in facilities, ensuring that there are access to planning time, strong leadership, all of those things that make for a quality program are things that we want to see in our preschool expansion. But we also know that adequate time is required, and that's one of the important structural components of quality. So what does mixed delivery look like? Well, if some of you are familiar who are listening on this webinar, we did an expansion proposal late last year to think about how we're going to use these expansion slots, and we heard from partners across the state on their feedback on that expansion plan. And at the time, we asked that there were a minimum of 240 slots to become a contractor for ECAP expansion. And since that time, we have changed our plan significantly. We have aligned it with the efforts that are happening with early achievers and also with that Washington preschool plan, and have really thought long and hard about how we encourage our licensed early achievers participants who have rated a level 3 to 5 to come on board and to help us innovate. So what you'll see in the new request for application is that we're now asking that contractors have a minimum of 18 slots, and there's a couple of ways that that can be done. If you have several preschool classrooms, then you could apply to be a contractor and meet the current ECAP standards, and that might mean that you are able to do everything in your own facility that's required of preschool, or that might mean that you need to contract with some agencies or entities in your community to provide some of the things in our preschool program that are outside of just quality instruction. So in our current ECAP program, we have what we call comprehensive services, and that is access to supporting families with health needs, mental health, medical, dental, wraparound supports for our families. We want to make sure that licensed childcare has an opportunity to apply for a contractor. In order to do that, we'll need to ensure that some of those health and safety or that health and wraparound services are maintained. So that is a possibility that contractors could be a standalone child care facility that's a high quality facility, a rated level 3 to 5, that has at least the capacity to serve 18 preschool children with these preschool expansion slots, and has mechanisms in the community to partner around family support and other health needs. The other opportunity would be to be a subcontractor. So if you don't meet the requirements of being a standalone contractor, licensed childcare can apply as a subcontractor with a larger entity. So for instance, a larger entity could be the fiscal agent that has the capacity to provide all those mechanisms for comprehensive supports that might be positions or contracts with communities to offer, for instance, medical and dental screening, and that those slots might be placed in a licensed child care or family home. So there's not a minimum requirement for being a subcontractor. You could have 2 slots where you're providing the quality instruction during the day, and there could be a larger contractor who holds the responsibility of being the fiscal agent and for helping with those partnerships around comprehensive services. One other idea, and again, we're interested in hearing from communities, is if several standalone facilities got together and put in a joint application. So what we usually call this is a shared services model, where a number of family home providers, for instance, could join together and put in a application together to make sure that that slot requirement was met, and to, again, ensure that there was the capacity to meet our current preschool standards by providing comprehensive services. So there's 3 different types of options that we really want to broadcast to our communities, and we're very interested in providing more detail and support around that. We'll be having a series of webinars after the request for application goes out that talks about how might people move on some of these models. We're really interested in questions that you might have coming in and having us think about those together. And again, we're really interested in innovation. One of the things that we're also interested in changing about our comprehensive service model is that currently, to meet the requirements for family support, health, mental health, nutrition, etc., we offer the same dosage and the same sort of wraparound supports to every child and family. And what we know is that not every child and family has the same level of need. We also know that there are children who are outside our current ECAP slots that also need those same services, and that it's not always cut specifically just by income. So what we'll be asking our expansion contractors to do is to join sort of a think tank of sorts with the Department of Early Learning to think about how we build a new flexible family service model to reach more children. And what that will look like is we're going to do an upfront needs assessment that we'll build together that really says, what does each child and family need? What's the level and intensity of support they need around these comprehensive services? And let's route them to the appropriate services in a seamless way. What we'll also learn at that upfront needs assessment is that not every child needs that intense dosage. Some children just might need access to quality preschool. And so we're going to differentiate that up front, which will allow us to reach more children than we're currently able to reach. So that's something that is not completely worked out, but we're interested in moving toward that model, and we're going to use these expansion slots to innovate, test out, evaluate, and think about how we can modify going forward. Here's a list of our funding priorities that you're going to see in the application. So, right off the bat, we are going to prioritize full-day models. So before we give out expansion slots to fund additional 2.5-hour programs, we will be interested in funding full-day models. We're also going to be looking at other priorities. So we have particular interest in their statute around ensuring that we're expanding in areas where there is full-day kindergarten already offered. There is a huge emphasis on P3 in our state, and we want to make sure that we are thinking about that transition between preschool and full-day kindergarten at all times. We're also going to be looking at the percent of saturation of current ECAP to make sure that we are reaching out to those areas that don't have preschool slots or a lot of preschool slots in their communities now. We're going to offer an example that's going to be sort of an invitational part of the application where we ask about other demonstrated needs. So if there are particular things that you as a contractor or a group of contractors are interested in addressing a specific need in your area, then we're very interested in hearing about that. We're also interested in special populations, for instance, children who might not meet the income level, but they are currently in the child welfare system, et cetera. Children with special needs. We want to make sure that we're considering other priorities to serve those children and families who are most at risk and in need. We also want to know the capacity and experience of each contractor. Again, we're still inviting our child care providers who have not yet been part of preschool and ECAP in our community. We want to make sure that capacity is built and supported. And then we'll also be looking at partnerships in mixed delivery settings. So we're going to give some priority to ensure that contractors are reaching out to licensed EA participants, and we'll give some points for that as well in the request for application. We also are setting aside 15% of our slots for rural areas and tribal populations to make sure that we are keeping our eye on, again, those communities that are most at need. So a big question is, how are we going to implement these changes without a lot of additional funding? And Washington State is trying a very innovative model to ensure that we have the funding to go forward with our preschool expansion. And what we're going to be doing is what is called grading or layering funding in order to make this happen. So our current ECAP funding will go, of course, to support expansion, but in addition to that, we're also going to be drawing down our Working Connections child care funding. So we are working right now, the Department of Early Learning is working with our federal partners to modify Washington's current CCDF plan. And these modifications would allow that every child that is eligible for ECAP also gets checked for eligibility in Working Connections child care. That's going to mean some changes to some things that have historically been in place related to things like immigration status, co-payments, things like what is the definition of work in Washington. So we are modifying our current plan to pretty much ensure that families that are eligible for ECAP will have some special consideration under our definition of being eligible for preschool in Working Connections Child Care Subsidy. And that combined funding will come together in one contract to the provider. So rather than thinking about having to combine funding sources locally, we want to do that braiding of funding, what we say, at the top. So at the Department of Early Learning, we're going to put those preschool funds together with a half-day Working Connections Child Care Subsidy, and that together is going to equal a 6-hour slot dollar amount that will be put into a single contract for 12 months. So in some ways, it's sort of like the contracted slots principle, if you are familiar with that. And I'm going to go over the models in a minute, but we're also going to have a beyond 6-hour day model, what we're calling an extended full day preschool slot, and that's going to be between 6 and 12 hours, where there will be ECAP dollars in combination with a full day Working Connections Child Care slot, and I'll show you some slides about that in just a second. We know that there have been differences between the requirements of ECAP and Working Connections to date that have made braiding funding difficulty. And I'm not going to go into the specifics of how we're getting at all of those specific issues. I just want you all to know that we are resolving some of these historic barriers to braiding at the top to make sure that we can make this happen. So obviously we're going to need this new funding strategy to make sure that we can increase those instructional hours for preschool. We also are really interested in making sure that there's a stable source of funding for our program, so that we know that in order to make this financially feasible, you not only have to have the dollars, but you have to have the predictability of funding that you'll get again in an annual contract. Of course, there are going to be requirements about ensuring that those slots are full, and we're going to ask our contractors to do that work of checking eligibility and entering that information in our Early Learning Management System, or ELMS, at the Department of Early Learning. We're also very interested in making sure that children who are taking advantage of these, of these slots, children who are placed in these slots, have a stable source of early learning. That we know that for those families who meet the requirements, there are often life circumstances that we see children go in and out of childcare, and we want to make sure that they have a stable source of early learning, both for providers and for those children and families. And like I said earlier, we're really working on coming up with a new braiding mechanism to reduce administrative burden. So what we're going to do is we're going to ask that all data be collected in one data system. We're going to try to streamline those reporting requirements so that our contractors only have to answer one ask for reporting, and that we're really looking at monitoring in a new way. What we're going to look at more going forward is, how are you using your data from early achievers to drive continuous quality improvement? How are we using that data to then connect with the data that we're receiving locally around walk-ins? How do we as a state think about moving toward strategies to support children's school readiness? And we'll be able to look at a lot of the administrative pieces through our early learning management system. So the key components, just to summarize again, are braiding our Working Connections Child Care dollars and ECAP funding together in an issued contract from the Department of Early Learning, so there'll be one contract with that braided funding, and one cost per child, and I'll show you the models. There is some geographic variability based on Working Connections child care rates. We're looking at aligning enrollment and eligibility processes as much as possible during that contract process, and also we're working on looking at our standards to make sure that we're streamlining monitoring and oversight and the contract requirements that we're asking people to do in local communities. So rather than having multiple people monitoring your program coming in, we want to make sure that that's not happening, and that, again, you're spending your time not on figuring out how you're going to bill for this. We don't want programs to invest in billing specialists. We want to make sure that we're doing that work for you at the department. So a few slides on the model. What you can see here is a chart that talks about our full-day pre-kindergarten, and that's the 6-hour-a-day model. What we're going to ask is that a minimum number of hours are met, 1080 throughout the year, and that can be done in a variety of different ways. So that could be a 4-day week, that could be a 5-day week, but we ask that you meet that number of hours across the day. You'll see that the funding is ECAP funding, which is currently at a little over $7,330 per child, in addition to a half-day Working Connections childcare slot. That funding will be graded at the Department of Early Learning, and you'll see that our target population, this is 110% of federal poverty level, is our target in our current preschool program. When you look at the per-child funding for that model, it's averaging about $9,700 per child. So again, if you had 10 slots, then that would be a contract. In a single contract, all of those slot dollar amounts would be combined for a 12-month period. There's a little asterisk there because there is some regional variation depending upon the Working Connections childcare rates, but in general, it's about $9,700 per child. The next one is our pre-K extended day, and this is what I was talking about, a 6 to 12-hour day. And what we're looking at there is ECAP funding in addition to a full-day Working Connections childcare rate. So again, there's variability based on geography. This is really meant for working families, so families who do need a full day to ensure that they have support during work, but they're still meeting the standards, high-quality standards throughout that entire day. There's an average per child cost in that example, in that model, of $14,000 per child. And then on the very right, you'll see that there is our current ECAP, where you see the requirements are at least 2.5 hours, 320 hours a year, that the funding will be only ECAP funding, and that there's an average of $7,331 per child. That is after a vendor rate increase this year. So all of our current ECAP contractors will get an increase to $7,331 per child. And we're also going to be, although it's not in this chart, interested in our current ECAP contractors who are interested in moving from a 2.5-hour to a 6-hour model. We're interested in what we're calling conversion slots as well. So we'll have some funding reserved for moving from a current 2.5-hour to a 6-hour program. This is just additional detail on all of those models. Again, a full-day model. You can see that in order to meet eligibility for Working Connections childcare, we're going to implement some standard training programs. This is for families who might be working part-time in job training or search. They don't need full-time services, a 6 to 10-hour day, but we do want to make sure that those children have access to a high-quality, high-dosage preschool program. This is our extended full-day model. Again, target population here are families who are eligible for full-day child care subsidies and that they are working families, the same model around braided funding, and we're really interested in mixed delivery, of course, with this model as well. And then finally, those conversion slots that I was talking about for our current contractors who have 2.5-hour slots, and they're interested in moving some of those to a 6-hour day. Now, we've heard some feedback from our school districts about moving to a full day is difficult when you have a morning session and an afternoon session, for instance, and many community partners also have this model of 2.5-hour or 3-hour morning and afternoon sessions. And one of the things that I wanted to throw out there is, again, we're very interested in innovation. So it may be that you could try, for example, a morning session at 2.5 or 3 hours, and then offer a 6-hour session in the afternoon so that you wouldn't be converting all of your slots, but maybe those afternoon slots for more of a 12 to 6 model, a 12 p.m. to 6 p.m. model, to allow conversion of some slots to a full day. We've had questions around, you know, I'm in a rural area and I have the facility space, but in order to do this, I might need to mix a current classroom of kindergarten children and preschool children. Will that be allowed? So what I want to put forward to everyone who's listening is we are very, very interested in innovation. You'll see that there's going to be a lot of room in the application to provide narration and to provide examples around your specific local community, and we really do want to hear from you. If you are generally in the ballpark of meeting the requirements, but have something extra to offer or something that might be an alternate, we're still interested in hearing from our communities about what might work. Here are just the basic applicant requirements. They're pretty standard. You have to be licensed to do business. You have to be part of Early Achievers, and there is a timeline associated with that. We will likely ask that our current licensed childcare who are participating in preschool expansion is rated a level 3 to 5 by the time that the contracts are issued, which will be in the July timeframe. You have to demonstrate the capacity to provide high-quality preschool and comprehensive services either on-site or, again, in partnership with community entities who are able to offer those comprehensive services, meet our current ECAP standards, which are available on the DEL website. And then service area agreements are something that has been historically in place for our current ECAP contractors, where there are agreements with local Head Start programs to make sure that there are specific areas where you have agreed together to do recruitment and enrollment, et cetera, to make sure that we're partnering with all of our local child care partners on the ground, whether it's Head Start or ECAP or child care, to make sure that we are collectively serving as many children as possible. And finally, we're going to ask that our contractors who apply provide some budget information. And this is just as much as wanting to know more about how local communities are making this funding work. It's something that we're very interested in learning more about as we go forward. Who should apply? We really are encouraging all sectors to meet the requirements to apply, to think about building partnerships and putting in joint applications, to reach out to current ECAP contractors as a licensed Early Achievers facility and think about if there's a way for slots to be housed in your current program, again with the idea of reaching out to where the children currently are placed. So we're looking to continue and to expand our partnerships with school districts, community organizations, again licensed childcare, tribal programs, and we're specifically interested in integration, of course, with Early Achievers, and that's going to be a requirement of anyone who puts in an application. The capacity to, again, meet these requirements, and we're also looking to our existing ECAP contractors to expand to even more slots or to look at conversion. So we're really asking all of our communities to think in a forward way, to think innovatively, and to put forward applications in a much more broad mixed delivery system than we've had to date. Here's a look at the process and timeline and what it's going to look like. The request for application will be released in mid-March, likely about the 15th. And we're going to ask that if you are going to apply, that you submit a letter of intent by early April. And that's really so that we can start planning how many different contractors we might have in this expansion process. There are also going to be bidders conferences, so a series of webinars that we're going to offer and publicize before those happen throughout March and April. We know that there are going to be a lot of questions about this, so we're going to have, for instance, a specific webinar around budget and some of the fiscal pieces, because we really do want to provide some TA throughout this process and make sure that everyone has access to those questions and answers. So there'll be live webinars, but they'll also be recorded for viewing. The applications are going to be due in May, and funding decisions in June. We're going to negotiate and finalize those contracts in July. And then although we hope that services begin immediately, we also know that we're asking contractors to do a lot of new work. And so we are also honoring a planning process, and that services must start by January 1st, 2015. So for some, we know that only a half-year model might happen in order to give your community some time to plan. What you can do now is to go through the rating process, or if you're currently rated a level 3 to 5, think about whether you alone can meet the standards to apply as a standalone contractor, whether there are partnerships with other EA facilities you might make to put in a joint application, or whether you want to explore partnership with agencies that can support those comprehensive services and apply as a subcontractor. What you see right here is a link to our current contractors in ECAP and contact information if you want to reach out locally. And then, as I mentioned, explore the Shared Service Alliance concept to see whether that might be a viable alternative as well. What I want to say in closing, that it's important to remember that this is really a learning year for our expansion. We honestly don't know what the demand for these full-day services will be, but we feel that the research and the national movement is very clear that we need to look at a full-day, high-quality, high-dosage preschool program. We know that there are still issues with available space, and that is really why we want to think more innovatively about a mixed delivery system. We are not changing anything in our current ECAP contracts. We're using these expansion slots to make the changes so we can learn more about what works and what doesn't and make those needed modifications in future years. So just as we are supporting programs to do continuous quality improvement, we want to model that at the state by using the expansion as a way to learn more about what works and what doesn't work so that we don't cause disruption in the current system until there's more information. And then finally, I just really want to stress how exciting this is for kids and families in Washington State. We are just going to continue to relentlessly pursue high quality and high intensity, not because we're being forced to do it, but because this is the right thing to do to really move this work toward a new vision to improve outcomes for children in all sectors of our community. So we know there's going to be lots of questions going forward, so stay tuned for those webinars, and in the meantime, take a look at the current ECAP standards, take a look at the contractor list, and let us know if you are interested in pursuing expansion and if you have other questions that we might help answer along the way. Thanks so much for your time. We're going to post this webinar if you have colleagues that were not able to listen in, and you'll hear more about the ongoing technical assistance throughout the application process. Thanks a lot.